Guess what? We don't need tort reform. Not for our medical malpractice system. Welcome to Dr. Deane's webinars on healthcare. I am your host, Dr. Deane Waldman. I'm Professor Emeritus in Pediatrics, Pathology, and Decision Science. Currently serve on the Board of Directors of the New Mexico Health Insurance Exchange, and I'm proud to say I'm the author of The Cancer in the American Healthcare System. This is a series of webinars on healthcare with titles as follows. What's really happening in healthcare? Should I buy health insurance or not? What would a good doctor do? Is the Affordable Care Act the answer? Single payer and other fantastical beings the cure? Something you definitely want to take a look at. And today we're going to discuss why we don't need tort reform. So we will discuss what is tort reform. We will talk about what's wrong with the medical malpractice system. And frankly, learn that the problem is a design flaw, which leads us to say we don't need reforming of the system and we need replacement of the system. And finally, we'll try to answer the question what you should do next. The tort reform that everybody talks about refers to a tort system that deals with lawsuits for medical malpractice. Now, medical malpractice is the old term. Currently, the lawyers prefer medical negligence. I must admit, I don't like that because even when a doctor makes a mistake, rarely is he or she negligent. They just made a mistake. They didn't forget. Medical errors are believed to result from medical malpractice or medical negligence, but people seem to think that errors are the same thing as adverse outcomes, and they're not. The system is based on tort law, which is, quote, a body of rights, obligations, and remedies in civil, repeat, civil court to provide relief to those who suffer harm from the wrongful acts of others. Both the public and scholars in law as well as in medicine, frankly, we all agree the current system doesn't satisfy anyone. Well, maybe except the trial lawyers, the medical malpractice lawyers. Any tort system is designed to do two things, and you can ask your legal friends, but this is what the law says. It is designed to identify the perpetrator and to, quote, make whole the victim. However, when you talk about the tort system for medical malpractice, the public has different expectations. They want to punish that SOB that hurt me or my child or my father. They want compensation when they're injured, and the public expects the system to ensure the quality of our care. The system that we currently have, the tort medical malpractice system, is adversarial, which means that for the patient to win, somebody, a provider, has to lose. That's the only way you can win or get compensation. The tort system fails. It fails for one reason. It wasn't designed to do what we want it to do. You don't get compensated unless the provider is proven to be negligent, even though you still were injured. An error in doctors' behavior or hospitals' behavior is not the same thing as an adverse outcome, which is a patient result. So one is a behavior and the other is an outcome or a result. Now, what you're seeing is somebody who obviously did something wrong in behavior. He left a clamp, hopefully not a scissors, in the chest of a patient that he or she operated on. An outcome is what the patient experiences, and obviously I've been dramatic to show a gravestone. The tort system fails because it wasn't designed to do what we want it to. The most common reason for bad patient outcomes are not bad doctors. The most common reason is limitations in our medical knowledge base. Frankly, there are a number of things that hurt injure, and frankly, kill patients that we don't know how to stop. If you have a glioblastoma multiforme, bluntly, there's very little we can do because we don't know how to make that tumor go away. Secondly, settling in our current system is almost always cheaper than trying a case and going to court. So there is this huge financial incentive to settle a case rather than to get a true and honest result for the patient. Bad outcomes, whoever caused them, whatever the cause, are shrouded by the whole legal confidentiality system, which makes it hard to impossible for us to learn from things that happen that are bad. And if we don't learn, we can't improve. And everybody knows from first grade that you learn from your mistakes. Well, if we hide them, then we can't learn. The tort system is bluntly the wrong model to try and compensate patients who are injured during medical care. These are two pictures that I found on the internet, one of a submarine and the other of a car, and I ask you the following question. If you add wings to the darn thing, can it fly? Obviously, that's a rhetorical question. You can't reform a bad design. You have to replace it, which is why we need tort replacement, not tort reform. We need to replace the whole system. Okay, what do we replace it with? Well, I suggest the following. Instead of having a medical malpractice system based on tort law, let's have what I call an Office of Medical Injuries. Now, this is described in detail in the book, The Cancer in the American Healthcare System, and I certainly hope you'll read it, but let me give you just a summary. The Office of Medical Injury has 4 divisions. It has a compensation division where it is decided by an objective panel, if you're injured, how much you should be compensated, period. No adversarial anything. If you're injured, we're going to try and figure out, the second division, dissolution, why, what happened, what was the medical chain of events that caused the injury. Can we determine that? Number 3, from determining why the patient was injured, can we learn to do better? And if we can learn to do better and get a better protocol, can we then share it with everybody so that we can have everyone learn from the bad outcome of the index patient? And finally, there's an oversight division that looks at patterns of behavior on the part of doctors, nurses, and hospitals to see if the same person is making the same mistake over and over and over again. With the Office of Medical Injuries, there's no courts, there's no trial, there are no lawyers involved, and frankly, there's no adversarial process. This is the answer for our tort problem, for our medical malpractice problem. It is tort replacement, not tort reform. What should you do next? I urge you to visit the website called wecanfixhealthcare.info, not .com, .info. There's a ton of information on that about the tort system, about the healthcare system, about the Affordable Care Act. I want you to consider the information on that website. It's free. I urge you to look at some of the other webinars that we have available, and you can access them through that link that I've shown you right there. It's an abbreviated one, bit.ly 1TIJCYB. Write it down and access it. And finally, I urge you to read The Cancer in the American Healthcare System, because it will answer a host of questions that you now have about our healthcare system. Thank you for your consideration of tort replacement rather than tort reform. This is Dr. Deane, and I look forward to communicating with you in other webinars.